any crepitus or anything that, you know, feels strange, raise your arms up for me just a little bit. Don't. I'm being relaxed. I'm just going to kind of feel your precordium there. I can feel. Now I'm also going to feel up here for their point of maximal impulse. Sorry. And I can feel that. Okay. So then I'm going to take a listen here. Big deep breaths again. Okay, raise your arms up. Okay, this side. Good. Once more. Okay. I'm gonna listen to. I'm gonna listen to your aortic valve. Listen to your pulmonic valve. I don't hear anything abnormal, which is good. I'm going to listen to Herb's point. Okay, listen to your tricuspid valve. And listen to your mitral valve. I'm also going to percuss a little in the front just to make sure it all sounds the same. Okay, raise your arms up for me. So now I'm going to move on. Everything seemed normal and good. I'm going to move on to the abdomen. So what I'll have you do is go ahead and just lay back. Put your feet right out there. Again, all I'm doing here is just inspecting. I'm looking for any pulsations I might see, any asymmetry. I don't see any surgical scars. I don't see anything that looks abnormal. So then the next thing I'll do is auscultate instead of palpate first. And we're going to palpate for a full 2 minutes, which is in the assessment, which for all quadrants. Okay. Then the other thing I'm going to listen to are some different arteries here. So like your aortic. I'm just listening to see if there's any abnormalities, like when you listen to the aortic artery. We're listening over here to both of to the renal arteries. And then to the iliac arteries. And then again to the femoral arteries. And I don't hear anything abnormal within those. So then we'll just do some light palpation here first. Just let me know if you have any pain if I push.
No.
No pain?
No.
Okay. So it's going to get just a little bit deeper here, seeing if I can feel any of your internal organs here. Any pain with any of this pushing?
No.
In here?
No.
In here?
No.
Okay. I'm going to just kind of percuss here a little bit. Okay. One of the things I do want to do is see if I can't find your border of your liver here. Take a big deep breath in for me. Okay, blow it out. feel your gallbladder. I'm trying to, but that's not an abnormal thing. So one of the things I am going to do here is I'm going to start up here at the top, and I'm going to see if I can't find the borders of your liver. Okay?
Yep.
Okay, so here is the distance that I could use our ruler, and the distance we could say would be, you know, how far apart or how large your liver would be right there. The other thing I'll have you do is, actually, I'm just going to see if I can't palpate part of your spine. That's pretty hard to palpate. See if I can't find the kidney right there. It's pretty hard to find. See if I can find, palpate over on this side. Come up on your right side. Look, don't fall off the. And what I'm going to have you do is bring this arm kind of up that way. And I'm going to percuss for dullness, which would be splenic dullness over here on this side. Okay? Oops, it's okay. So right about this area right here is the dullness that I could percuss for for your splenic area. Okay? So I'll let you.
I don't see any cuts, any scars. The skin, the lungs raises with each breath. She has a good respiration rate. She's on labor. Okay, and I don't notice also on the back. She also has no bone deformities. Her lung also raises. There's no scars. There's no indication of any surgeries in the past. So I'm gonna go ahead and first I'm gonna palpate her chest. So tell me if it hurts. I'm gonna do it in a Reiki pattern. Okay,
No pain.
Okay, very good. So once I do that, I'm going to auscultate. I'm going to percuss. I'm sorry. Auscultate. I said auscultate and I percuss instead. Okay, can I listen to you with the bell on my stethoscope? Very good. Wait again. Very good. Once we do that, I'm gonna ask you to please turn your back to the camera. Very good. So I'm gonna, like I said, inspect the back. The skin is normal. Her chest raises. So I should be checking for percuss the chest. I'm going to do the control, it's called CA, control vertebral angle, okay, which is doing it on the kidneys. But first of all, I'm going to do the pectoris femoris for any vibration. So say 99.
99.
Again.
99. 99. 99.
And I should hear the vibration. Okay. Now I'm gonna go ahead and palpate. Tell me if it hurts. Here.
No. 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 No.
Okay, very good. Now I'm going to percuss. She heard like an echo. Okay, and finally I'm going to auscultate her lungs. Okay, I want you to take a deep breath. Okay, and I am going to check for CVA, which is putting my hand in here and feeling. Tell me if it hurts.
No. No.
This is checking for the kidneys. Okay, so now we're going back to the front. Would you mind turning it back? Now I'm going to inspect the heart and vessels, just to give you a little heads up. If I hear anything unfamiliar, any abnormal sounds, I should do a bronchophony, a gophony, and whisper pectoriloquy. And if I need to assess further, I will ask Vanessa to move forward, sitting forward, only on her left side so I can be closer to the heart and assess. I also going to listen to the heart valves, starting with the aortic valve, which is located in the second intercostal space, right midline. Continue with the aortic, with the pulmonic valve, located in the second intercostal space on the left sternal border. Continue with the second pulmonic of Erb's point, which is located on the third intercostal space on the left borderline. Continue to the tricuspid, which is on the fourth intercostal space on the left borderline. And finally, the mitral valve, which is on the fifth intercostal space, mid-clavicular line. I also want to address that if the S1 is the closer to the tricuspid and the mitral valves, and the S2 is the closing of the semilunar valves. Once again, I gotta address that if you hear S1 murmur is a systolic murmur, and the S2 is diastolic murmur. So now I'm gonna go ahead and listen. Aortic. Pulmonic. Second pulmonic. Tricuspid. And the mitral valve. Also, you can hear the PMI. I'm going to palpate. Raise your breath for me, please. And you can actually feel the mitral or the PMI. So we're gonna continue with the abdomen. So would you please go ahead and lay down for me? So we're gonna check all 4 quadrants of the abdomen. First of all, I'm gonna inspect for the skin. The skin is intact. There's no scars. There's no rash, any wounds. She has a belly button, and she got a piercing in her belly button, and the umbilicus is midline. I'm also gonna check for the aorta, which is located right here above the belly button. I should be able to feel it. Okay, and now I'm gonna continue. First of all, I'm going to auscultate because I don't wanna activate bowel sounds or create any unnecessary sounds. I'm gonna do it in a Greek key way. Okay, and she has normal bowel sounds. Now I'm going to palpate. Gentle, I don't want to upset her. Tell me if it hurts.
No.
Okay, I'm gonna do a heart palpation. Okay, and some percussion. I'm also gonna inspect for the liver and the kidneys. So I should be able to ask her to take a deep breath, and I'm just gonna do like a deep pressure. So I'll be able to feel the liver. If it's enlarged, I should be able to feel it. It's under her ribs. And the kidneys, I should be able to check the kidneys. That's stay flat. Okay, I just pull my hand behind their back, and I pull. And I should be able to feel the kidneys. They hurt?
No.
Okay. Now the other side.